Welcome to the Advances in Research and Innovation stream of SNOMED CT Expo 2024. My name is Victor Medina and I am Senior Terminologist and the CSRM Lead Datum at SNOMED International. I will be moderating today's session. All questions will be answered at the conclusion of the presentation. Online attendees, please use the Q&A button to type your questions to the presenter. On-site attendees, please use the microphone provided in the room. I'm now pleased to introduce Elze Groot from NICTIS, who will present research on implementation and use of nursing terminologies in electronic health records worldwide. Elze, please go ahead.
Thank you. Thank you for the opportunity to talk here about our research about the use and implementation of nursing terminologies in countries around the world. An overview of what I am going to talk about. Of course, I'm going to talk about the research methods and findings we used. To be able to understand why we did this research, I also will talk about our current situation in the Netherlands. And I will end with conclusions and next steps. So, who are we? My name is Elze. I am a terminologist. I am in the nursing terminology for quite a while. I also participated in the ICMP SNOMED mapping process. I'm doing this research together with Renate. She is a colleague of mine and she is an advisor on international projects. She also has a background as a nurse and she has worked at a nursing association in the Netherlands. So where are we working? We were working at NICTIS. NICTIS is a competence center for information management in healthcare. We are making information standards. We are advising on implementations. Oh, this one's not going to. I can hold it. Oh, that's also. Yes. I'm gonna step down. Okay, we are making information standards. We are advising on implementation. We have the Terminology Center, which is also the NRC of SNOMED. And we also have give advice on international projects, and we participate in international projects about data exchange. Our motto is better health through better information. So, the current situation in the Netherlands, we have to deal with more than one classification that is in use. And we are making an information standard for the nursing care plan. That's the Dutch nursing e-discharge. It's getting implemented now, but it's not used yet. The information standard is based on the nursing guidelines. It's based on a norm, a Dutch norm for the nursing e-discharge. And it refers to a Dutch government law about data exchange in healthcare, where the nursing care plan is also in scope. The aim of the data exchange is to have uniform data in EHRs and also to register once to use it, also for secondary use. The terminology in the information standard is SNOMED, and the information model we use are clinical building blocks. The e-discharge is made together with the Dutch Nurse Association And we have agreements about the building blocks, about the use of SNOMED and the use of fire. So these are the sections of the e-discharge. And the problems we have in the Netherlands are on the last two sections, because free texts are used and classifications are used and system-owned codes are used. We also did try to do a mapping between, we have Nanda and we have Omaha. We tried to map these two with SNOMED in the middle, but we found out that it's just an impossible exercise. So because of the classifications we use and the move we want to SNOMED, we thought we are going to do research and see how other countries are doing it. What terminology are they using? Are they implementing it? Are they also make a shift from classifications to terminology? So what can we learn from other countries? So what do we want to learn from this research was how can we implement the nursing care plan taking into account the international context from today. One thing is that we did not finish the report yet. So the report is to be published next year. So what was our aim? We wanted to get insight into the main policy of data standardization in other countries and about the use of classification and terminology in other countries. And we also wanted to get insight into the difference in management and authorization of classification and terminology. We used two study methods. We did a desk research and we sent out a questionnaire to all NRCs and to all nurse associations. For the desk research, we wanted to get more insight in the policy framework of governments and nursing associations, and to get more insight into the classifications and terminologies and how they are managed and authorized. You see here a list of websites we used. The online questionnaire was to get more insight into the current situation in international policy in other countries. We had several questions we sent to the countries, and that is to indicate which terminologies are used, to indicate how many resistance there was in countries using SNOMED, and also if there were already guidelines and what the strategy is. As a quick overview, we got an answer from 28 countries with 53 respondents. Most respondents came from USA, I think there were 18. And most respondents came from Europe, these were 17 countries. Okay, well, our findings. The nursing terminologies in use we got back are these lists. So the CCC, the EPAC, the FinCC, Interrai, some German classifications, and of course the NICNOC, Nanda, and Omaha systems, and SNOMED ICMP terminology. There's an overview of Europe, the correspondence in Europe. You can see that SNOMED ICMP is at different extent levels in use in most countries. And Nanda Nik Nok is second best. I tried to get in a table as kind of classification. I looked at whether there is a national policy or strategy to go to SNOMED, and I looked if the nursing care plan is already in scope for that country in that strategy. And I looked if it was already implemented or if it is started or finished implementation. We saw that Portugal and Norway are already using it, the SNOMED ICP ref set. Iceland is planning to use it. Finland is planning to map their FinCC to SNOMED. And we have a lot of countries in Europe that want to go to SNOMED, but have not yet a strategy to do so. And in Oceania, so Australia and New Zealand already use SNOMED and or ICMP. The governance and authorization, we looked at the different classifications and terminologies to see what the governance and authorization of the standard is. That's quite important because if you want to use a standard internationally, you also need to maintain and authorize it internationally. So we looked at the 4 that are most important for the Netherlands. We see that SNOMED and ICMP are represented by international nurses and member countries. And that the license also is at a national level, and that it is maintained by international groups. And for the classification, it's not always very clear how it is authorized. And the license is on an organization or IT vendors level. So what are the conclusions we took for now? We see that there's a policy that most countries do a shift to SNOMED or ICMP, or have SNOMED as a national strategy. So we do see a paradigm shift. We see a paradigm shift that countries go to SNOMED. Some countries are using it already, some countries are planning to go to there. But there's not yet an international policy for nursing care plan. And I think that's very hard needed, especially because we see that countries are going to SNOMED. It is the moment to also have an international policy. We also see that there are countries with more than one classification. Thanks. And that countries struggle to go to SNOMED because these classifications are in use. And questions are raised about the governance. Who's the holder? Who's responsible for developing and managing the terminology? And is the holder legally accountable? What does this mean? So a lot of questions yet. The next step is that we want to validate verification about our findings that we got from the countries. So we want a stamp from the countries on our report. And we will publish the report after that, first in the Netherlands and after that also outside the Netherlands. So thank you for listening, and I'm happy to take any questions.
Thank you, Elze. She will now take questions. As a reminder, if you're in the room, please use the microphone to ask your questions. No questions here. We have some over here. How can we exchange nursing data when countries use different standards to document nursing data?
Can you repeat the question?
Yeah, sure. How can we exchange nursing data when countries use different standards to document nursing data?
Now, I think all countries should go to the SNOMED ICMP ref set, because if all countries use the SNOMED ICMP ref set, we can exchange data very easily. Because I think the mapping from classifications to SNOMED ICMP does not work, especially when you use more than one classification in your country. So that's what we experienced in the Netherlands. But that doesn't make it easy.
Does not. Any question in the room? Okay, we have another one for you all. What approach would you suggest to work together on nursing terminologies among countries?
I think we should, the countries should cooperate. So I think the nursing care plan should be part of the EHDS project, and we can there work together to have a common nursing care plan, or a nursing care plan that can be exchanged together. And I think the same for the IPS and other international projects.
Is there any other question here in the room? Okay, hearing not, with that, we will conclude this session. Online delegates, you can stay here for the next presentation in this stream or access another session to the event lobby. Thank you very much, Elze.